Okay, let's take a look at case number 15. A 42-year-old woman who works in a pork processing plant presents to her physician with new onset seizures and bilateral lower extremity weakness. CT of the head reveals several calcified regions and cystic masses, but no solid mass lesion or evidence of bleeding. A complete blood count reveals mild anemia and a WBC count of 78,000 millimeters cubed with 12% eosinophils. So let's take a look at this. See if we can see that. All right. So what is the most likely diagnosis? Cysticercosis caused by Taenia solium, a pork tapeworm, is a cestode tapeworm infection. When the tapeworm infects the brain, it forms small, non-purulent abscesses that can later calcify. The disease then becomes known as neurocysticercosis and is responsible for the majority of adult-onset seizures in developing nations. How does the organism involved in the condition cause illness? Ingestion of undercooked pork induces larvae from pig muscle into the human gastrointestinal system. These larvae mature in the small intestine. Eggs from the adult worms are released into the feces. Ingestion of these eggs via the fecal oral route allows eggs to enter the GI tract, where they develop into larvae. The larvae then penetrate the intestinal wall and migrate into the blood and tissues. Because humans are not a natural host for this stage of the organism, the larvae encyst into various organs. What signs and symptoms are associated with this condition? Infection can be asymptomatic or can cause malnutrition and abdominal discomfort. Cysticercosis can be found anywhere in the body, including the brain and eye, leading to seizures, focal neurological symptoms, and blindness. What tests can help confirm the diagnosis? Intestinal infection is revealed by eggs in the stool. Calcified cysticerci can be observed on CT of the head when cysticercosis occurs in the brain. X-ray may reveal calcified cysticerci in other parts of the body, such as muscle. What are the appropriate treatments for this condition? Praziquantel is used for cysticercosis, and albendazole is used for neurocysticercosis. In addition, steroids and anticonvulsants may be given for decreasing complications of neurocysticercosis. Asymptomatic patients are rarely treated. What are the other cestodes? Diphyllobothrium latum is a cestode transmitted by ingestion of freshwater fish that causes vitamin B12 deficient macrocytic anemia. Echinococcus granulosus eggs are ingested from dog feces and can cause liver cysts.